we're going to go through a relatively regimented surgical approach, being an orthopedic surgeon myself, through this to make everybody equal time. So we're going to start right off the bat. Please introduce your moonshot and tell us a little bit about your company. So we'll start with you, because you're next to me, Lynda.
Hi, Lynda Brown-Ganzert, Curatio. Our mission is no patient alone. So we've built a platform that's used in about 104 countries now in 20 languages that uses AI and machine learning to connect patients to other patients that are going through the same thing. The end goal there is to make sure that no patient is alone and to provide health literacy, tracking, coaching, medication reminders for an end-to-end patient support solution.
Outstanding. So, Sathya, we're talking about Aidar now.
Yeah.
Talk about that.
Great. Sathya Elumalai. I'm the founder and CEO of Aidar Health. Our moonshot is really focused on bringing access to high-quality, patient-centered care. Everybody really talks about health equity, and there are a lot of discussions around presenting data and technologies. We provide a single device that measures your overall health in 30 seconds. It's an FDA-cleared solution, and with this, we are actually taking it to every single individuals. Our mission is to at least get to 1 billion people in the next 5 years. Hope we can achieve that.
You want to set yourself a little bit a higher goal? It seems a little entry level.
It's like 1/10 of the population.
That's just, why not? Jason, Undivided.
Yes. Good afternoon, everybody. My first moonshot is I want socks as cool as you.
Oh, I can arrange that.
So I'm Jason, and our moonshot is to help parents raising kids with disabilities get the best care possible. Inspired by my own journey, I have a son who has a rare genetic disorder. And as I've gone along that journey, I've run into many families raising kids with autism, Down syndrome, cerebral palsy, and realized that there's this giant hole in the world around making sure these kids get the best care possible. There's about 13 million kids like my son Noah in the US, 100 million globally. And the burden of getting holistic, personalized care for these kids falls on one person, and that's the parent, typically the mom. And you know, this gap, this inability for a parent to find a trusted partner to help them navigate medical, therapeutic, and educational support services to the total of $200 billion spent a year and $20 billion out of pocket for these kids is just a big failure by the entire system in helping these kids thrive. So we've built a platform to be that trusted partner for families raising kids with disabilities. And the simple idea is that the knowledge is out there to help these families and these kids thrive. We put that knowledge in our parents' pocket every day and help them save time, save money. But at the end of the day, we're their partner and giving them the confidence they're doing all they can to help their child thrive.
Which brings us to Samer and Zeel.
Thank you, Stefano. Samer Hamadeh, Zeel Health. We are a technology-enabled in-home medical care company, and we specifically focus on musculoskeletal pain, so MSK pain. We're building an army of specialists to treat this pain. We're currently at 6,000 massage therapists, physical therapists, nurses, and behavioral health specialists. And chronic pain is a massive problem. It affects 100 million Americans, and it's very hard to treat. And of course, you all know about opioid addiction and its attendant issues. So we are going to the home with these specialists and touching the patient and treating the patient, and the results we're seeing are just fantastic, which I can talk about a little bit later.
And MSK, close to my heart, right? But it turns out most people don't understand is 20% of Medicare spend is related to the musculoskeletal space. It is a massive vertical that people are just trying to realize how effectively it can be addressed with some of these new ideas and technologies. So thank you for bringing that to us.
Thank you.
So I'm going to start back with you now. Let's
Okay.
talk about Zeel. Let's talk about this moonshot and also this focus. Where do you see the greatest opportunity in that particular space? What do you wish we all knew about it specifically so we can understand how challenging this is?
Well, I think we would like health plans and employers to and practitioners to understand that massage therapy in particular is a really good treatment. First, it feels really good. Second, it's already in the physical therapist toolkit. It's CPT code 97124. Just if you've ever had manual therapy with a PT, it's 5 to 15 minutes at best, and the literature shows that 60 minutes is the desired treatment. So we come into the home and deliver a 60-minute treatment specifically addressing a diagnosis or a specific pain point, and it really works. And then with respect to in-home, the people who are going to facilities typically are driving 20 to 30 minutes each way.
Yeah.
Then they're in the waiting room up to 45 minutes, the surveys show. So you're wasting an hour and a half plus to get your treatment. When we come to you, no waiting time, no travel time, and you feel really good afterwards.
Terrific.
And the data we've been collecting with one of our first pilot partners, the VA, Department of Veterans Affairs, shows that about a third of patients are seeing long-term, good effects in terms of mood and sleep and pain levels and mobility.
So Jason, same question to you. What do we need to understand about this particular problem? You outlined it for a little bit, the challenge of achieving, this young parent that just doesn't know how to navigate the healthcare system. You told us how big of a problem it is. Where do you think the biggest challenge is? I think we talked a little bit off stage. It's an access issue, right?
Yeah, it is. And if we talk a lot about social determinants, population health, and if you think about this population of 13 million kids, the number one determinant of health outcomes is the parent. And it's hard to overstate how isolated and overwhelmed these parents are when they get that initial diagnosis. And that overwhelm lasts their entire life. This manifests in 2x the divorce rate of typical families. You have parents who have stress levels on the level of parents coming home from, or soldiers coming home from war. And the last thing is 40% of families, millions of families a year, have a parent leave the workforce because this is a full-time job, navigating these systems. Right. So the big unlock that we found and we figured out is that, as I mentioned earlier, the knowledge is out there. It's with these parents who have gone on heroes' journeys to help their child achieve better outcomes every day. We hire the best of those parents. We give them a wage that honors what they've learned and earned, and we put them in the pocket of all of our families so that you get through to those isolated parents. All of a sudden they feel like they have somebody that has their back, and they have a teammate that can support them in getting access earlier to the care needed to help these kids thrive, and to coordinate that care. As I mentioned earlier, this is care. There are interventions happening in medical, therapeutic, and in school for these kids, all uncoordinated, and we help them pull that all together and drive towards better outcomes.
So Undivided is very focused on a very specific niche population, but Aidar is actually a much broader play. So what do you see the biggest challenge of your moonshot?
No, I think although it's really broad, but I mean, it started off with like every condition has as a challenge, right? From diabetes and hypertension, we take it for granted, but that's what downstream it leads to chronic kidney disease or lung functions or heart conditions, which I faced. I mean, that's just what we really started Aidar. My mom started with diabetes and hypertension. Now she has 4 chronic conditions. I wish I had known about it. I wish I had provided the data to help her to change her behavior, right? At the end of it, changing behavior is very important in any disease management, and personal data has worked in terms of helping changing somebody's behavior, but getting that personalized data has become a hard commodity in healthcare. Yep. So that's what we are offering. We're offering that technology and the data to them so that they can make sustainable behavior changes. So the challenge is it has to be taken into different conditions. So we're starting with asthma and COPD, and then we are going into cardiovascular conditions.
And they now not only have a data point, they have a sequence of data points, which they can then go to Curatio to learn about what to make sense of, how to make sense of that information. Is that correct? Sort of the idea here for Curatio?
Yeah, in many cases, we really try and meet the patient where they are. So for some folks, I mean, you've had a heart attack, your life changes in a matter of seconds. You're living with a rare disease. It's more of a day by day. You have a child that's just being diagnosed, and where do you go? So, yeah, very much providing that day-to-day support and filling in the gaps that are missing for both the patient and provider and the health system overall.
Terrific. All right, change shift a little bit. We have a group of potential investors, potential partners for each of your companies, but I'm going to ask just Jason and Sathya to tell me a little bit. if there was a potential partner, what are you looking for in that partner? What kind of a growth potential? If you're looking for growth, or we're looking for an investor, what kind of mindset were you looking for?
For us, we are working actually with a number of pediatric care partners, children's hospitals, therapeutic providers, as well as developmental pediatricians. And what we're looking for is partners who are looking to support these families who've recently got a diagnosis, are overwhelmed, and they leave these offices with a laundry list of things that they're supposed to activate. So as a quick example, we're working with Children's Hospital Orange County's Autism Center to really help their families, as they get this diagnosis, go out in the world and activate all the services and supports for their child. So we're looking for partners in that vein. We're in California now. We're going national later this year. So if you're looking to help families raising kids with disabilities, we'd love to talk.
Awesome. Aidar.
Yeah, I think for us, we're primarily working with pharma right now. A lot of efforts from digital companion, digital biomarker, real-world evidence studies. I think one thing that I would hopefully want them to change their mindset is, like, everyone talks about wearable devices. Oh, how it is different from wearable devices. Can I get a wearable device? Because we want to see them on a daily basis, which is great. But I think once they stop using it, that's it. Like, it has to be simple. So which is what we are providing, our solution, which is far more comprehensive. Even if you measure using our device for a couple of times a week, that's a lot more information than actually getting it from a wearable device that measures 1 or 2 parameters. So that's what we are looking for, and definitely we're raising. So we'd love to hear from people who are interested in joining us.
Excellent. I'm going to switch speed a little bit again. I brought my own Hogwarts-approved magic wand, and I give it to Lynda to wave it a bit and tell us in 20 years, if everybody's using Curatio, what's the word look like? So go right ahead. It's perfectly magic.
Well, I'm going to make it 5. So in 5 years, every patient has the social health prescription like the one that we provide. It's fundamentally ludicrous that we don't have that we send people home after a diagnosis, home from the hospital, and they're left to figure it out on their own. So it doesn't cost very much. We know that it has a tremendous impact on health savings. It has a statistically significant impact on health outcomes. We have all the data that we could ever want on knowing that this works. So in 5 years, that this is a standard of care, that everyone gets a social health prescription.
Awesome.
In the world.
And why don't you wave it for Samer's? Oh, maybe you can wave it yourself. Go ahead, right ahead.
Wave it for me.
Yeah, last one.
This is cool, Stefano. Well, look, in 20 years, we will have our 100,000 person army of practitioners, and they will treat 5 million plus people in person. But we really want to leverage technology so that we can use health coaches and wearables and other tools to help tens of millions more to take care of their MSK pain remotely.
That sounds like a great vision. Woo-hoo. All right, yes, absolutely. All right, in 40 seconds, though, of a quick take-home message for all of us. So you're present in 102 countries. What advice do you have for other entrepreneurs about achieving global dominance like you have?
Global dominance. Solve for the world. Don't think of just your region or just your country. Healthcare is a problem worldwide. So think of that with the user in mind of how this can work around the world.
Awesome. Aidar.
I think for us, definitely from our perspective, we really think it's a massive industry. We really wanted to focus on technologies like ours to bring it to the patient care, and we really think providing personalized data can help with empowering consumers to make change that is far more, I think, sustainable.
Actually, one more question for you. You got 510K approval for your device. That's quite a complicated thing to go through. Any take-home messages about if you had to do it again, you came up with another product?
No, I think we should start early. Talking to FDA, I thought like FDA is going to be evil, not really helping us to get clearances, but they've been phenomenal. Talking to them, FDA representatives or your lead reviewers, early, and then do it more, as frequently as possible, so that you can get to a point where we got our entire 10 plus parameters cleared in one single submission.
Impressive.
Which is unheard of. So that's why I think it's impactful if you start early.
Jason, Undivided, you launched a social network with an instant backlog. What have you learned about scaling?
Yeah, I think the key, as always, but I would say even more critically for this population, is you have to just be myopically focused on delivering for those families every day. And so, I think about my patient population that we serve. Everywhere they go, they run into wait lists. Everywhere. Therapy, medical, school systems that support these kids. So when we launched, we were very thoughtful about how do we not use the Silicon Valley wait list, red velvet rope approach to serving these families. So we've been very methodical in delivering value to any family that needs it when they show up at our door, and then supporting them at kind of higher and higher levels as we have the ability to scale up, and we've cracked the code on that and are excited to go national in the months ahead.
Very impressive, by the way. Samer, Zeel, I have a question for you. Creating a virtual health care network that delivers in-home care in the middle of a pandemic has its challenges. Did you just give out a lot of hand wipes and masks, and what happened?
Well, if you only knew, we went from over 50 million of revenue to zero in 2 weeks in March 2020, and we couldn't go back into homes and in corporate workplaces for quite some time. So we had to get very creative, very nimble. We offered virtual classes to a lot of our corporates when their employees were at home. That helped bring in a lot of revenue. We did some socially distanced but in-person classes where we taught people how to stretch and massage, but without touching them. Imagine that. And then we decided to get into the COVID testing business, like so many people did, but we offered COVID testing at home and COVID vaccinations at home. So we ended up doing 70% of the revenue that we lost in the last 18 months.
So could that be something you've been continuing and also at-home testing? Maybe with portable devices?
Hopefully, yeah. We're focused on MSK care, but COVID forced us to be creative, so we added some additional verticals, and we're exploring what to continue with now that we're past COVID.
Excellent. Ladies and gentlemen, thank you very much for participating. I want to remind you to go see Curatio, Aidar, Undivided, and Zeel downstairs. Thank you very much.
Thank you, guys.
I need my wand back. We have another group coming in.